Hi, I'm Reglan, and today we're going to show the demonstration that you need to know if you find a person choking. Choking means something such as food or an object that has stuck in the airways, preventing air from getting into the victim's lungs. Choking can be mild or severe. The mild choking means that the victim can cough and make any sounds. Let them cough trying to remove the object. And if you're worried about the victim breathing, do not hesitate to call the emergency hotlines. The severe choking means that the airway of the victim is completely blocked and victim will panic and will not able to breathe or make any sounds. The severe choking, there's no coughing, no crying, and no sounds. Your quick response for choking to save the victim's life. And the universal sign of choking is the hands crossed at the neck. It's gonna be like this. In order to do this, stand behind the person and make a fist and put your fist just above the belly button. And then grasping the other hand until the object comes out and the person can breathe, cry, or make any sounds, or to become the victim has responsive. And if it is not work, you need to begin a CPR. So this time, I will demonstrate the infant choking. Now, if there is a case that the infant is choking, you need to know the basic saving life technique because quick response for choking can save the baby's life. As if that this is the infant. To get the object out, you need to get the series of back slaps and chest thrust. Let's start with the back slaps. Place your baby face down over your forearm and then supporting the head and neck with your hand. And then you may wish to support your arm on your thigh. Then give a good back slap down toward the head. Let's try. 1, 2, 3, 4, 5. And if the object does not come out and the baby was still weakly squirming, no sound, no cough, and no cry, turn the baby face up, supporting the head and neck with your hand. And then place your 2 fingers just below mid-nipple line with the center of the chest. And then give the 5 chest thrust. 1, 2, 3, 4, 5. If the infant no sounds, no cough, no cry, please continue from the back slap steps and 5 counts of chest thrust until airways is clear and the baby's cry or make some noises. And now I will demonstrate the child choking. If the child is choking and unconsciousness, signs include looking panic, blue color around the lips, and you may ask if is there okay. Hey, are you okay? Are you choking? And if the child did not respond, if ever you ask them if is there okay, and then without cough, cry, or any sounds, let them give an abdominal thrust. Place your fist just above the belly button and then perform the abdominal thrust. 1, 2, 3, 4, 5. And then continue until the object is clear and the patient can breathe. Let's demonstrate the adult choking. Now, let's cover the highly effect and very important skills good for the adult choking. If you are in the scenario, do not hesitate to call the emergency hotline to give help to the victim. In this case, we're gonna come up to the person, we're gonna look their eyes and ask, "Hey, are you choking? Are you choking?" And then the person did not respond, we need to let them know to help them. Now, elevate your elbow and make a fist and just put above the belly button and perform the abdominal thrust in 1, 2, 3, 4, 5, and then continue until the object comes out. For the unconscious victim, once the victim will become unconsciousness, let's perform the 30 chest compression, check for the object and sweep out if possible, and attempt the 2 breath. Now, let's gonna perform the 30 compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. If there is no chest rise and full attempt 2 more breaths. And then continue this process until the airway is open and the air goes into the lungs. Then check the pulse if present without breathing. Or the victims wake up, cry, or cough, or the emergency personnel come to the rescue. So now, let's gonna talk the special consideration as if saving to the pregnant woman choking. You know where we going this as saving life skills. Let's remove the obstructions from the airway and the person is pregnant. We need to understand that we're dealing with 2 patients to save the mom and the baby. So it is important that we're aggressive to find the treatment, but there's a special way to do it, so that we don't injure the baby inside the womb and the process. So let's take a look on how we do this right now. So, as if this is the pregnant here. So we all know that the baby is here in the normal location, and here is the position. 1, 2, 3, 4, 5. And then we're gonna continue the process to save the life of the baby and the pregnant woman. And now I will demonstrate the self-response. The abdominal thrust and back blows are the most common technique to help someone who is choking. But what will you do if you are by yourself and choking? So now, I will show you and how to use the chairs or any hard surface within the choking emergency if nobody can help you. First, do not panic. You most likely only 1 minute to react safe and sounds. Second, call an emergency responder even if you cannot talk with. Third, the self-maneuver. Find hard surface or edge like chair. So it's gonna be like this. Or you're gonna make a fist and put it just above your belly button. 1, 2, 3, 4, 5. And then continue the process until the object comes out or the responder comes to the rescue.